We're going to now go on to Hannah Ryan, who is our final speaker. And Hannah Ryan is from the UK, and she is going to tell us about how we can submit to the World Health Organization guidelines, is a call for feedback on the health of trans and gender diverse people. So Hannah, thank you so much for coming on, and I'm going to hand over to you.
So this is me. I am a doctor. I'm a specialist registrar in clinical pharmacology and general medicine, and I work in the northwest of England. I'm a former, or I'm an author and former editor with Cochrane Infectious Diseases, and Cochrane are an international collaboration that produce systematic reviews of evidence that are often used in evidence-based guideline processes. And I've been previously involved in several guidelines projects as a methodologist. I'm also part of Labour Women's Declaration, and I am the secretary of the Clinical Advisory Network on Sex and Gender, which is a UK and Ireland network of healthcare workers thinking about sex and gender issues. And this is my brief declaration of interests. I don't have any financial, institutional, or academic interests in the outcome of this guideline. It obviously relates to my work in CAN-SG and LWD, and I have said things in public about these issues in the past. Okay, so just a very brief background. The WHO is a specialised agency of the UN, and its primary responsibility is international public health, but it's also engaged in human rights work insofar as the right to health is engaged, which will become relevant later. So what they're supposed to do is make guidance on lots of aspects of public health, and that extends from sort of epidemic infectious diseases down to sort of chronic diseases, sexual health, reproductive health, everything. And often their guidelines are used at national level around the world to help set policy frameworks or to support policy frameworks. And they've got an evidence-based process that they're supposed to follow when they're making guidelines. So this guideline is a new guideline for WHO. They've never made one specifically on trans and gender diverse people before. Just a sort of language caveat, I'm going to use WHO's language, so I'm going to talk about trans and gender diverse people, but I'm going to tell you what they mean by that in just a second. So the focus of this guideline will be 5 areas. So you can see there on screen, that includes provision of gender affirming care, including hormones relating to adults. So this guideline won't look at children under the age, or anyone under the age of 18. Health worker education and training for the provision of gender inclusive care, provision of healthcare for trans and gender diverse people who have suffered interpersonal violence, and health policies that support gender inclusive care, including legal recognition of self-determined gender identity for adults. And of course, they don't really mean self-determined gender identity, they mean self-determined legal sex. So this is the definition that WHO are working with for trans and gender diverse people. And I did sort of think that actually probably a lot of the people on this call would come under this definition, because it includes basically anyone who's gender non-conforming. So it's a bit wishy-washy, but we're all used to there being no real definition of what we mean by trans. So the timeline for this process, this began in 2021, and a stakeholder consultation happened in 2022. So the stakeholder consultation will have involved UN member states, but it also largely involved trans rights organisations around the world. And we can see that there are specific organisations who've contributed to the scope and development of this guideline. And then in 2023, in June, there was a public announcement announcing the first 14 Guideline Development Group members. And the Guideline Development Group is important because they're the group of experts that come together to look at the evidence and make recommendations for a guideline. So they're very influential to the outcomes of a guideline. So I think it's fair to say that most people who are interested in this area missed this in June. We must have been paying attention to something else and we didn't pick this up. But then there was another announcement on the 18th of December, and we did notice this one. And they announced 7 additional members for the guideline development group. And that's when really kind of an international response from people who were critical of gender medicine and from feminists kind of began. So the Society for Evidence-Based Gender Medicine put out a position statement. The Who Decides petition that perhaps some of you have seen was started. Reem Al-Salem, the UN Special Rapporteur for Violence Against Women, wrote to the Director General of the WHO. And really, I think it's fair to say that the WHO steering group in charge of this guideline were not surprising this was not expecting this level of international interest, and they have extended the deadline for responses to this process. So the responses are all mainly about the guideline development group members, but also about the scope of the guideline. And this has been extended to the 2nd of February. And the provisional date for the first meeting of the guideline development group is the 19th to the 21st of February in Geneva. So that's the sort of close timeline that we're working with. So what is the problem with this project? Probably many of you will have already sort of thought what the main problems with this project are. But the main issues that, as I see it, are there's a validation of gender affirming medical interventions that's kind of assumed in the language of this announcement and all of the information that we've had from WHO so far. And they're not actually going to look at the safety and efficacy of these medical interventions, which would be a normal process for a WHO guideline on a healthcare intervention. They're going to look at interventions to increase access to these medicines. So they're not going to look at whether the medicines work or whether they're safe, whether they're appropriate, what kind of assessment people should have before they have them. They're going to just look at how we just increase access to them, because they're obviously a great thing. And that's particularly worrying because we know that the composition of the group that we might term trans and gender diverse has changed a lot over the last several years. And now in some countries is majority young people between sort of 16 and 25, and majority female and majority same-sex attracted, with a significant proportion of people who are neurodiverse included in that population. So, and then the other obviously big thing is the promotion of legal self-determination of gender on the grounds of public health and the health of trans and gender diverse people. So this is interesting that they're leveraging a human rights argument for access to medicines and a health argument for access to a legal change of sex. And this kind of policy direction has been a long time coming from WHO and the UN. And I'm sure there are many women on this call who've been tracking that. And I think it's perhaps not surprising that this is now what we're seeing from them. But there we are. And then there's a big problem with the guideline development group. So out of 20 people on the group, 8 are doctors, 5 of them are associated with WPATH, which is the World Professional Association for Transgender Health. There's 1 lawyer who specializes in LGBTQI plus rights internationally. And then there are 11 advocates from various different trans rights organizations, including GATE and ILGA and others. So there are no people on this guideline panel that can talk about detransition. There are no people who can talk about the impact of legal self-ID on women, and particularly on marginalized women and lesbians. There are no people who can talk about, no clinicians who can talk about managing people who have transition regret or detransition. So it's an inherently biased and conflicted panel. Oh, there we go. So this is what WHO say. They've released an FAQ paper to go with the announcement that they're extending the deadline for responses. I think they think that they're going to be able to sort of just explain what they're doing and then everyone's complaints will go away. But actually, they've released more information for us to get angry about. So this is their rationale for why legal self-ID should be included in a public health guideline document. And the key bit there, for trans and gender diverse people, the lack of legal gender recognition is a key barrier to access to health services, in addition to the full enjoyment of other rights, such as freedom of movement and right to adequate housing, education, and employment. And remember that this is a guideline that's being devised for an international audience. So it's looking at situations all over the world, not just in the global north. And this would be a sort of a flagship policy in many for many people to take to their national government to try and further efforts to move towards legal self-ID. So I think it's important to note that the stage that this guideline is at, they're at the stage where they've done some evidence review, they've recruited a guideline development group, they've set the scope of their guideline, but they haven't sat down, looked at the evidence and made recommendations yet. So we don't know exactly what they'll recommend. But it seems quite likely that this guideline will increase pressure on governments to adopt sex self-ID in law, and certainly on institutions, health institutions, to enact self-ID of sex, which effectively removes single-sex provision and sex-based language in health settings. It also promotes the general idea of gender identity and the erasure of sex in health education and training. And it will probably have a disproportionate impact on low and middle income countries, where WHO policy is often more important, given higher importance. And it certainly will be leveraged by trans rights groups everywhere, and particularly where women have made gains against sex self-ID. So what can we do? We can write a response to WHO before the 2nd of February and ask them to address the bias of the guideline development group. And I've got a whole series of links where you can find more information about this. You can see responses that have already been submitted. And that's the email address at the Global HIV Programme, which is one of the departments of WHO that is hosting this guideline process. I think also, and you shouldn't feel that the 2nd of February is a deadline for this second one, but it's very important to write to government representatives and public health officials. So in the UK, that would be Kemi Badenoch as our Minister for Women and Equalities, and Victoria Atkins, the Minister for Health, and Chris Whitty, our Chief Medical Officer, and ask them to raise questions with the Director General of WHO and the Chief Scientist, and their regional representatives on the WHO Executive Board. So WHO as a UN agency functions like other UN parts of the UN, and they are sort of political and diplomatic organizations. So if we can get political representatives to contact them, that is highly impactful. If you can get this issue into the news where you are, that also puts pressure on WHO. So probably part of the reason why they've extended this deadline is because the Times, the Guardian, the Daily Mail have been covering this issue in the UK. It's been covered in the press in the US. So as much press attention as we can get for this, the better, because that puts pressure on WHO to at least be seen to be taking action. And we really need to share the news that this is happening with sisters the world over and encourage them to take action. It will be particularly powerful if feminist groups in low and middle income countries take up this issue and write to their representatives and make representation to WHO. This issue will disproportionately affect those settings, and they have, of course, as Sarah alluded to, many other issues that they are concerned with. They don't need to be fighting battles on legal sex self-ID. And then if you want to connect with me and with others who are sharing skills and sharing information about this, then I'd be very happy for that. I'm learning about this as I go along. I'm not a human rights expert, and I'm not an expert on how you lobby a UN agency, but I'm trying my best to learn as I go. And there are definitely some tasks that we have developing arguments around the human rights end of this, because the sort of evidence-based medicine part of it, there are now many clinicians around the world who are engaged on that, and we can easily make those arguments. But when they've taken an issue outside of, what they've done very cleverly over the last 2 decades is to take this issue out of a mental health context. It's no longer a mental health diagnosis. And so access to transition treatments becomes a human rights issue. And that makes it extremely difficult for clinicians to push back at this level.
Who led the WHO guideline process?
It's being co-convened by 3 WHO departments: the Global HIV Programme, Department for Sexual and Reproductive Health, and WHO Gender, Women, Gender, Equity and Human Rights, not women, Gender, Equity and Human Rights. You can see actually over the last decade, particularly the Global HIV Programme have been increasingly captured. I think that's fair to say. So trans rights lobbying groups have been sort of using that kind of silo to sort of push forward a lot of their agenda. And there are sort of good clinical reasons why people who are interested in HIV are interested in particularly trans-identifying men. They do have higher rates of HIV in various settings. So you can see why there is there's a legitimate reason for them to have an interest in that area, but it's increasingly sort of expanded to other aspects of gender affirming care and the legal aspects of gender identity.
Is there anywhere we can get advice about what to say in response to the consultation?
So CanSG's statement is online. You feel free to use that to help. There's SEGM's statement, which is a bit more detailed. There are, you can pick one aspect of this whole issue because obviously it covers a load of things. So you can, if your priorities are around young people and young adults and the safety of gender affirming care, then write about that. If your issue is women's sex-based rights, write about that. And the emphasis should be on the guideline development group and pointing out that the guideline development group cannot deliver a balanced guideline on these issues because they are all people who espouse belief in liberalised access to gender affirming care and legal sex self-ID.